with yet another presentation on toxicology. Yes, it is heavy metals once again. We have already dealt with two very important heavy metals, arsenic and lead, and the third in this series of heavy metals that we refer to as the unholy trinity. We will be dealing with that metal today, mercury. But when we talk of mercury, unless somebody knows that this is a session on toxicology, what comes to mind is perhaps this, isn't it? The planet Mercury. Beautiful. Doesn't it look beautiful? Oh yes, it is. It is the innermost planet, closest to the sun. So must be very hot, isn't it? Must be the hottest. I'm testing your high school chemistry, or is this physics? I forget. It's astronomy. Not really. Mercury is not really the hottest. The hottest is actually Venus, which comes after Mercury. That is because Venus has a very dense atmosphere, if I remember right. And it traps heat like the greenhouse effect. And that's why Venus is hotter than Mercury. Earth is all right. We are all living on Earth, though it is becoming hotter by the year. From Mars onwards, really becomes quite cold, all the planets. Right up to Pluto, which is the coldest. But then enough of astronomy. We are not talking about the planet Mercury. We are talking about this, Freddie Mercury. One of the most iconic rock singers of all time. Many of you may have heard of him. Many of you may have listened to his songs. Some of you may have in fact watched the biopic, the film on him. He is one of my all-time favorites. But sorry, we are not even referring to Freddie Mercury. When we are talking about Mercury, we are not looking at this singer who was part of the rock band Queen that gave us such beautiful hits like Bohemian Rhapsody, Another One Bites the Dust, and that all-time favorite stadium anthem, We Will Rock You. We are talking, as you all know, really about elemental mercury. This session is devoted to this very deceptive metal. Look at how beautiful it is in the image. It's a liquid metal, one of the only metals that is liquid at usual conditions. Silvery, isn't it? Nice to look at and maybe play with. But not really, it's a deadly heavy metal. I told you, part of the unholy trinity, the others being lead and arsenic. Mercury, even in the elemental form, can be dangerous, not on ingestion, not if you swallow it really, but if you inhale, because elemental mercury vaporizes all the time. We never realize it because the vapor is non-irritating. But all the time it is volatilizing, and when you inhale it over a period of time, you get very seriously ill. We'll come to that later. So let's look at the synonyms for mercury, the heavy metal. It's called quicksilver, and you can guess why. The chemical name is hydrargyrum, often shortened to Hg, and as I've already mentioned, mercury is heavy, silvery, liquid, usual conditions, vaporizes at room temperature all the time to give off fumes of mercury that are not irritating, and so it can be lethal even without you knowing it. Especially important from the chronic exposure point of view. For instance, suppose somebody has spilt elemental mercury, it's very difficult to pick it up. I think some of you who have unfortunately broken a thermometer or a sphygmomanometer bulb and mercury that got spilled would have known as to how difficult it is to scoop up mercury, because it breaks up into smaller and smaller droplets. cleaning up mercury is always a big problem. We'll come to those details perhaps a little later. Aside from elemental mercury, which is dangerous in the form of inhalation, we have derivatives, salts like inorganic salts, of which there are two very important mercuric salts, mercuric chloride, which is called corrosive sublimate, and mercuric sulfide, which is called cinnabar. Once upon a time, very commonly used in vermilion or sindoor by Indian Hindu women in the parting of their scalp hair as a sign of marriage. Nowadays, what you get is mostly non-toxic or relatively non-toxic material, so you don't have to worry. Once upon a time, it was mercuric sulfide, which is highly toxic. Then you have mercurous salts, of which the most important is mercurous chloride, also called calomel. These are all inorganic salts of mercury. Among the organic salts, the most notorious is methyl mercury. We'll come to the details in a short while from now. Plenty of uses for mercury. I'm sure all of you know from your high school chemistry, mercury has been used in thermometer, barometer, sphygmomanometer, that is of course the blood pressure apparatus, fluorescent lamps, and of course even in dentistry as an amalgam for dental fillings. Thermometers nowadays don't really use mercury, that is being phased out because of toxic concerns. So also the case with sphygmomanometers. There is a drive which is ongoing to replace these dangerous mercury-based sphygmomanometers with those which don't use that element, even barometers. And once upon a time, fluorescent lamps, we were so excited when we were children and we were used to that yellow light, and all of a sudden this came into the picture, the fluorescent strip lamp, strip lighting, which had this blue, nice kind of light, and it transformed our lives. Little did we realize that the tubes contain mercury and quite toxic, especially to the environment. As long as the tube is not broken, it's all right. But once a fluorescent lamp is broken, mercury is released and it can contaminate the environment, it can be toxic. So please make sure you don't break these lamps before disposing, dispose them intact. And that goes for the so-called CFL also, which is very popular nowadays, which stands actually for compact fluorescent lamp. And that's also something which contains mercury, that also has to be disposed of carefully. With regard to the amalgam that is used in dentistry for dental filling of caries, that is also being phased out, and there are other kinds of materials that are taking its place, but still it has not gone completely. So these are some of the common uses of mercury, some of them diminishing, some others persisting. With regard to exposure, we come to the clinical features. Due to acute poisoning as well as chronic poisoning, we look at what are the effects when somebody is exposed to elemental mercury, inorganic mercurials, and of course organic mercurials also. But first of all, acute poisoning resulting from inhalation of elemental mercury. This gives rise to cough, dyspnea, fever, chills, headache, metallic taste, gastrointestinal distress, and a strange kind of disease which resembles the so-called Kawasaki disease. I think you all may have heard of this disease, especially if you are from the medical side. And for the others, I must mention that Kawasaki disease is an illness in children who are predisposed because of a hyperimmune kind of reaction to infection. Some children suffer from various kinds of manifestations like conjunctival congestion with red eyes, fever, and even the palms and the soles become red. Tongue becomes reddish, so it's called the strawberry tongue, a very important feature. And there can be a skin rash, usually if I remember right on the genital area, and there can be large enlarged lymph nodes in the neck. These are some of the features, and mercury exposure can also give rise to features like this. That's why it's called Kawasaki disease-like symptoms. Not exactly Kawasaki disease, which nobody really knows the cause for. With regard to ingestion, it's mostly salts and mercury we are talking about, and with regard to mercuric salts, there can be GIT corrosion. One of the important mercuric salts, in fact, is commonly called corrosive sublimate. I told you, mercury chloride. And that can give rise to abdominal pain, vomiting, diarrhea, and systemic features later on, including shock, pulmonary edema, renal failure, etc. A characteristic feature is pinkish urine. These are some of the images to show you what is seen in Kawasaki disease in a child. You can see red lips, reddish palms and feet, and you can also see a rash, especially on the genital region, and you can see the characteristic strawberry tongue. Has it gone? This kind of disease? Not really, unfortunately. It has come back stronger than ever in the midst of this terrible pandemic. COVID-19 can also give rise to similar kinds of manifestations, and that is called multi-system inflammatory syndrome in children, MISC, or also referred to as pediatric multi-system inflammatory syndrome, or PMIS. Can give rise to similar kind of manifestations like Kawasaki disease with fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, etc. So, unfortunately, this kind of illness is not really going out and is making a kind of comeback with newer infections, and we have to watch out. Even though it's not really common in even children, this kind of syndrome, but one has to watch out for that, and that is why very important to prevent exposure of children to COVID-19. Coming back to mercury, chronic poisoning is called hydrargyrism. You will remember chronic lead poisoning is called plumbism. So remember the term hydrargyrism, because that stands actually for that. That is because of the other name for mercury I told you, hydrargyrum, or represented by the symbol Hg. In chronic poisoning, there can be inhalation, elemental mercury, over a period of time that can give rise to tremor, which begins as a coarse intentional tremor in the hands, and later on progresses in severe cases to lips, tongue, arms, legs. In the mild form, it is called Danbury tremor. In severe form, it is called Hatter's shakes. It's a terrible condition. It's called Hatter's shakes for a reason. Well, once upon a time, mercury was used commonly in the manufacture of a particular kind of hat called a felt hat. I'll show you an image later. You may have seen in classical old Hollywood films, males, when they go out on the street, usually they wear a kind of hat, which is actually the felt hat. And nowadays, of course, that has gone out of fashion. And in the manufacture of such hats, mercury was used, and it gave rise to these kinds of manifestations in workers in the hat industry. There are also other features that can be seen, like ataxia and reeling gait, severe incoordination sometimes, and the person may find it very difficult to walk in the severe stages. There is also metallic taste, loss of appetite, salivation, that's sialorrhea, gingivitis, that is inflammation of gums, and often bad breath. There is also a cluster of manifestations relating mainly to the mind, which is called erethism, characterized by abnormal shyness, depression, irritability, often associated with amnesia, and later on progressing in severe cases delirium with hallucinations or manic depressive psychosis. So it's a psychiatric disorder, and this is sometimes referred to as Madhatter. Madhatter, from the character in Alice's Adventures in Wonderland by Lewis Carroll. We'll come to the image a little later, where there's a character called Madhatter, and he usually talks absolute nonsense. If you have read that story, which is pretty fascinating, it's a children's story, but very fascinating, you will understand, you will remember this particular character. Then there is a condition called mercurial lentes, which is a brown reflex of anterior lens capsule with sometimes punctate opacities, and that can give rise to serious visual problems and renal damage, like in the case of most heavy metals. So this is what I refer to as felt hat. This is the characteristic kind of hat that was common, very popular among gentlemen of some Western countries, especially the US, and they used to wear this kind of hat very often, especially when they go out into the streets. Today, of course, this kind of hat is not very commonly seen, and that's a good thing because, as I said, the process of making felt involves the use of mercury. This is a character, the Mad Hatter. You can see this man, this character wearing this top hat, and this is the Mad Hatter. And the term Mad Hatter in mercury poisoning refers to this particular character in Alice's Adventures in Wonderland. And this is by Lewis Carroll. It's a very entertaining kind of story. It's a classic as far as children's literature is concerned. The other characters, of course, are Alice, you can see here, and then the March Hare, and this is a dormouse here. And you can see a number of cups on the table with a teapot. This is the so-called Mad Hatter's tea party, which is a tea party that never ends. As to why that is so, why they keep drinking cup after cup of tea, you should go back to that book and read it, or I'm sure if you have read it thoroughly, you will know as to why this particular tea party never ends. But then, let's get back to mercury. Chronic poisoning we are talking about. We talked about inhalation, that is hydrargyrism, and now we come to ingestion. Ingestion of salts can give rise to, over a period of time, if it is in small quantities, colitis, that is inflammation of the bowel with sometimes pigmentation, that's called melanosis coli. There can also be psychiatric manifestations, especially dementia. There can also be tremor, the characteristic kind of tremor that mercury is infamous for, and of course renal damage. In children, we get what is called acrodynia sometimes, which is also referred to as pink disease for a reason. This is characterized by loss of appetite, insomnia to begin with. Later on there is sweating, there is a skin rash, and the hands and feet become puffy, pinkish, painful, paresthetic, perspiring, peeling. And I have a mnemonic for you, the child peas. There are many such fascinating mnemonics. Some of them may appear a little offensive to you or rude, but they are very effective mnemonics and helps you remember. The mnemonic stands, of course, for the series of P's here, which are very important in pink disease, which incidentally also starts with the letter P. Pink disease, also called acrodynia, the important thing is the hands and feet become puffy, pinkish, painful, paresthetic, perspiring, and in later stages, peeling. I'm afraid I have not got very good images for acrodynia, because this is something that has fortunately gone out more or less, not very commonly seen. Once upon a time, when teething powders which were given to children who were in that stage, teething stage, contained mercury salt. And today, of course, such powders are not popular, and even if they are there, they don't contain mercury. And that is why pink disease or acrodynia is not common today. With regard to organic mercurial poisoning, that is very much around, and that was first seen in the so-called Minamata disease, sometimes spelled M-I-N-I, so it can be pronounced Minamata, correctly actually it is Minamata disease. This is in Japan, a village actually to begin with. Today it's a major city. In those days, I think this happened in the 1960s, the people who were living, that's a coastal area actually, started manifesting peculiar kinds of signs and symptoms. We'll come to those details, and later on it was found that it was because of contamination of the water in the coastal area with methyl mercury, mostly in the form of industrial effluents, but also some other sources were there. And this methyl mercury, as you can see in this image, the effluents coming into the body of water, all this is mercury, which is in the form of mostly methyl mercury, and that is taken up first by the phytoplankton, and later on by zooplankton, and later on by other kinds of fish, and especially gets concentrated in large fish like shark. So if you eat a lot of fish, especially deep sea fish like shark and other big fish, then there is a greater possibility of suffering from what is called Minamata disease, which is a terrible kind of disease. As you can see, the symptoms and signs here: peripheral sensory loss, tremors, dysarthria, that's difficulty in articulation or speech, ataxia or incoordination, muscle weakness, and leading in severe cases to paralysis with hearing and visual loss and coma. Death can also result. These are some terrible images of that disease from those years when this particular disease was around. Fortunately, today there are measures to see to it that such pollution doesn't occur, and even if it does, it's taken care of, and people are not exposed to this kind of mercury contamination of water anymore. And so you don't have to worry too much about eating fish, especially as I refer to the larger fish like shark. Once upon a time, a lot of precautions used to be taken with regard to eating large fish. Today, because a lot of measures have been taken to prevent mercury contamination of water, and that leads eventually to food chain. Today that is not very common. I may mention here that shellfish also can be sometimes affected by this mercury, and the form of mercury that is often is a culprit in Minamata disease is methyl mercury, which, as I've already referred to, is an organic mercurial. Diagnosis: the usual things with regard to heavy metal poisoning. Can take an X-ray if it's acute ingestion, like all other heavy metals. This is radiopaque, and you can also go for blood and urine mercury levels. That is fairly kind of clinching, and in forensic cases you can do hair analysis. Treatment for acute poisoning: you can do kind of symptomatic or supportive measures. You can decontaminate if the patient is seen early enough by stomach wash, and in later stages you can do chelation. That is, of course, the hallmark of treatment with regard to chronic poisoning. Chelation has to be done if the mercury levels are high, and the usual chelating agents that are employed include British anti-lewisite or dimercaprol, that if you recall is also used for arsenic, and the usual dose here is 100 milligram deep intramuscular injection every 4 to 8 hours for 10 days. Very painful procedure, but that's usually what we do in India. In Western countries, there's a better antidote called DMSA, dimercaptosuccinic acid, sold usually as Succimer, Succimer, and that is now available even in India, especially if you order online, and that is given orally. That is the advantage. 30 milligram per kg per day for 5 to 10 days. It does not have the kind of adverse effects that is seen in the case of BL also, and certainly not very painful as far as administration is concerned. If these antidotes are not available, you can go for the second line antidote, penicillamine, which is strictly speaking specific for copper. The other name of penicillamine being cuprimine, but it is also effective for mercury, and that can be given at a dose of 250 milligram orally. Just like DMSA, this is also oral, so you don't have the pain of injections, and it is usually administered 4 times a day for 10 days. These are the important chelating agents for mercury poisoning. Coming to medical legal importance, once upon a time, because of its use in therapeutics, various kinds of mercury salts and all that, iatrogenic poisoning used to be common. Incidentally, mercury was also used once upon a time, long ago, for syphilis and several other kinds of debilitating diseases. Today, mercury is not used in therapeutics at all. Industrial exposure still occurs from time to time. Domestic exposure also, though, as I said, instruments or devices like thermometers and blood pressure apparatus and all that don't contain mercury anymore. There may be some devices which are still persisting, but actually they are supposed to be stopped as far as manufacture of these kinds of thermometers and devices are concerned. Dentistry, again, mercury is being phased out, and fillings of late are mostly amalgams which don't contain mercury or other kinds of synthetic material. So even there exposure is coming down. Food poisoning, there are sporadic cases still being reported, and that's because of pollution of coastal waters by industries, and the type of mercury that's involved, as I've already mentioned, is methyl mercury. Suicidal poisoning and all that is not seen at all virtually, and homicidal poisoning is also extremely rare. So that is all with regard to mercury, the important points that every medical student especially needs to remember, and also doctors who are treating cases of poisoning who may come across mercury exposure, they need to remember at least these basic details. And this information, I think, will be also useful for forensic professionals. And this entire presentation has been brought to you by the Indian Society of Toxicology. Please do subscribe and get notifications periodically of all the kinds of presentations that we will be uploading from time to time. Thank you, and see you again some other session, some other toxic element. Goodbye.